Welcome back to Bariatric Business Accelerator. I'm your host, Carol Clark, and this is part 2 of Before You Hire. Now, I know what the series is called, and I want to address something right up front. If you already have someone in your patient care coordinator role or someone who guides the experience for your patients in your practice, this episode is still very much for you, maybe even more so, because one of the most common situations that I encounter in various practices of all different sizes and healthcare institutions isn't a practice that needs to hire a patient care coordinator. It's a practice that already has someone doing some version of the job. You know, in small practices, people have multiple positions, but the role was never clearly defined, the person was never really trained for it, or somewhere along the way it became clear that the fit really wasn't quite right, and yet nobody has addressed it because that's uncomfortable for most people, and because things are mostly functioning. So whether you're hiring for this role for the first time, thinking about backfilling it, or quietly wondering, is the person currently in the seat actually the right person for this job? This episode is going to give you a clearer picture of what the role should look like and and how to measure it, what to measure it against. So, the patient care coordinator is arguably the most important role in a weight loss or bariatric practice. I know the surgeons, the physicians are super important. Every team member is important. But I say this with full awareness that those people are important. But here's why I say this is such an important position. In most clinical settings, support staff manage tasks. They room patients, they handle documentation, they manage scheduling, and those things matter. But the patient care coordinator in a weight loss practice particularly manages something harder to define, which is the patient's relationship and how they feel about their journey. They are often the first real human voice a prospective patient hears. They're the person who follows up after a consultation when a patient is on the fence about moving forward. They're the one who checks in to make sure after certain periods and notices that someone's gone quiet and they've kind of fallen out of the system. They hold the emotional thread of the patient journey in a way that no other role really does. And this is particularly before they would have surgery, that sort of thing. But weight loss patients are not just managing a medical condition. As you know, they're navigating something deeply personal, often something they've struggled with for years, sometimes decades. The person who talks to them most needs to really understand that. They need to be able to meet patients where they are without rushing, without judgment, and without making a follow-up call that feels salesy. That's a very specific kind of person, and they are not always the person who happened to be available when you needed help for that particular position. So let me speak directly to those of you who already have a patient care coordinator or someone coordinating adjacent work. Perhaps they have multiple roles, and you're not sure if it's working the way that it should. Here are some signs that are worth paying attention to, things that I've noticed, but the things that you would want to watch for are that patients are falling through the cracks after consultations, nobody's following up consistently, your conversion rate from inquiry to being an enrolled patient feels lower than it should be, and the person in this role seems to be going through the motions perhaps, completing tasks, checking boxes, but there's no real warmth or ownership in how they engage with patients. Or maybe they're perfectly capable, but the role's never really been clearly defined. So they're doing their best without a real roadmap or a real system in place. Any of these scenarios is fixable, but they require different solutions. A capability gap needs training and clear expectations. A temperament gap needs an honest conversation about whether they're the right person for the role. And role clarity gap needs you to sit down and actually define what this position is supposed to do and what success looks like. The mistake I see often is treating all three of those as the same problem, or worse, not addressing any of them and just hoping that things are going to improve on their own. They rarely do. So whether you're evaluating a current team member or you're interviewing someone new, here's what I want you to know. You cannot train in this role. You cannot train genuine warmth. Patients in your practice are often very vulnerable, as we just talked about. They may have been dismissed by other providers, felt shame around their weight for years, or tried and failed at multiple programs before finding you. The person who talks to them the most needs to actually really care, and patients can feel the difference between someone who does really care and someone who's performing, so to speak. You cannot train comfort with emotional conversations. As you know, some people can freeze when a patient starts crying, which is common, or expresses frustration or shame. That discomfort will show up every single time. And in this work, emotional conversations aren't the exception, they're part of the job description. And you cannot train the ability to follow up without feeling a lot of pressure, the patient feeling pressure. The best patient care coordinators I've seen are persistent without being pushy, so to speak. They check in because they genuinely want to show and know how the patient is doing, and they want to know how the patient is feeling, and that quality is either there oftentimes for people in their personality or it isn't. What you can absolutely train is everything specific to your practice, your program protocols, your patient pathways, your follow-up sequences, your EMR, how you handle insurance questions, how you talk about your different program options. All of that is teachable and learnable. And this matters because I see practices either pass over strong candidates because they don't have bariatric specific experience or care coordinator experience, or keep an underperforming team member because they do have that experience and retraining someone else feels like way too much work. Neither of those is necessarily the right call at all. The right call is to hire or retain for the qualities you can't teach and train confidently for everything else. So, whether you are interviewing somebody new or doing an honest assessment of someone already in that role, I have 3 different scenario-based questions that will tell you a bit about if it's the right person. If you're interviewing, you can say, tell me about a time that you've had a difficult or uncomfortable conversation with someone. What did you do and how did it go? You're listening to see, you want to hear emotional maturity, not a perfect outcome necessarily. You can also ask, a patient had a consultation 3 weeks ago and hasn't responded to 2 follow-up attempts. How would you approach the third? You want to hear someone who leads with genuine curiosity, not pressure or script following, someone who genuinely wants to know why they fell off and how they can get them back into the practice. You can also ask, how do you stay organized when you're managing multiple patients at different stages of their journey? And you're looking for someone who owns their own systems, not someone who needs external structure to function, although we do have many software tools that help with that. I love talking about that as well. For a current team member, you can just take those questions and adapt them as conversation starters rather than interview questions. The answers will still tell you what you need to know. So one last thing, and that is onboarding. If you're bringing someone new into this role or essentially resetting the role with someone already in it, be realistic about the ramp time. Really, 90 days is almost the minimum before someone is truly comfortable as a patient care coordinator in a weight loss or bariatric practice. There's a lot to absorb clinically, emotionally, and operationally, and we want them to put their own little stamp on it a little bit too. Rushing that timeline because you needed someone yesterday is one of the most common reasons a good hire turns into a disappointing one. So give them the ramp time. Build check-ins at 30, 60, and 90 days and make sure that they know exactly what success looks like at each one of those milestones. Because if they don't know what they're aiming for, you can't be surprised when they miss that milestone. So in part 3, we're going to talk about what comes after that hire or after you've reset the role and how to lead a team that performs without you. Sounds wonderful, huh? We want to make sure that getting the right person in the seat, that's really only half of the problem. How you lead them determines whether they stay, grow, and actually move forward with your practice. So that's really important. That's what we'll be covering next week. If I can be of service to you or have any questions, reach out to me, Carol, K-A-R-O-L, at weightlosspracticebuilder.com. And otherwise, I will see you next week. Take care.